morning and afternoon to everyone. My name is Katie Lighthall, and I'm the coordinator of the Western region of the Wildland Fire Leadership Council. We, along with the Northeast and Southeast regions, are the home of the National Cohesive Wildland Fire Management Strategy, and we work across the country to facilitate implementation of that strategy and also work to advance a number of high priorities both nationally and regionally. So a quick reminder, the vision of the cohesive strategy is to safely and effectively extinguish fire when needed, use fire where allowable, manage our natural resources, and here's the kicker, as a nation, live with wildland fire. Our webinar today fits squarely into our objective to help stakeholders understand what it means to live with wildland fire. And that last part, living with wildland fire, is important to us because it speaks to the understanding that there is really no future that doesn't include wildland fire as well as smoke from both prescribed fire and wildfire. The cohesive strategy outlines several management options to make progress towards its goals of landscape resiliency, fire adaptation, and a safe, effective wildfire response. One of them is to use prescribed fire. And we closely follow those efforts that seek to support that option so we can learn as much as we can about both types of smoke so we can make the best decisions in our agencies, our organizations, and communities across the US. So today I'm very pleased to introduce Jason Sachs, Senior Epidemiologist, I hope I said that right, at the Center for Public Health and Environmental Assessment at the Office of Research and Development in the US Environmental Protection Agency. We are recording our session today, so you'll be able to visit this conversation again on our website and YouTube channel at your convenience. And just a little background, our parent organization, the Wildland Fire Leadership Council, requested an assessment of air quality and health impacts of prescribed fire compared to wildfire from the EPA in collaboration with the US Forest Service, the Department of the Interior, and the National Institute of Standards and Technology, the NIST. Mr. Sachs will be giving us a short presentation on 2 case studies in a comparison of those impacts of prescribed fire versus wildfire smoke. And we'll be using the Q&A platform today. So if you want to go ahead and include who you are and where you're from in the chat, that would be great, but we'll take questions and comments in the Q&A box. You'll see that at the bottom. So be thinking about any questions or comments you might have and just put them in that box. So, all right, Jason, it's all yours. Thank you.
All right, well, thanks for the introduction, Katie, and thanks for the invitation to be here. And so let me, actually, I think you need to allow me to share my screen because it just said it's disabled for me.
Here you go.
Okay, so let me get this going and then hopefully. So do you see the full screen or the one with the notes?
I've got the full screen.
Awesome, great. Well, thanks again for the invitation to be here and to present on the comparative assessment of the impacts of prescribed fire versus wildfire, a case study in the Western US, which we often refer to as the CAFE report. Before I jump into the presentation, I do need to display this disclaimer, just to note that the views are mine and do not necessarily represent those of the EPA. So to give you a little bit of background information of how this report came to fruition, Katie touched on it a little bit in her introduction, but as I know many of you are aware that there is a rationale for more prescribed fire in the Western US, and this can be attributed to both the increasing number of large wildfires as well as the increased likelihood of wildfire ignitions, both due to a variety of reasons, including almost 100 years of fire suppression, changing climate, et cetera. In addition, the agencies involved in this report have differing policy challenges. On the USDA and Department of the Interior side, there's a need to reduce the potential for the negative impacts of wildfire, particularly through the expanded use of prescribed fire as a management tool. And then on the EPA side, there's a need to limit air quality impacts and the subsequent public health impacts of poor air quality due to smoke from both prescribed fire as well as wildfire. Therefore, it became clear that as the desire to increase the use of prescribed fire as a land management tool has grown, so is the need for a common understanding and reconciliation of the benefits of prescribed fire and the adverse health effects of smoke. And so this led to the Wildland Fire Leadership Council requesting that EPA conduct an assessment of comparing smoke impacts from both prescribed fire and wildfire, and ultimately resulting in the EPA proposing in January of 2020 that we're going to conduct a health impact assessment of prescribed fire versus wildfire. So I'll note that there is a broader definition of health impact assessment that the WHO has, which is the multi-step process. For this assessment, that's not what we view health impact assessment as. We view it as a quantitative assessment of the smoke and public health impacts. And I'll touch on what this means later on in the presentation. So ultimately, this led to the goal of the CAFE report being that for 2 case studies that we were going to compare the air quality and health impacts between hypothetical scenarios of different fire management strategies, as well as a comparison between prescribed fire activities in each fire location, and then the actual case study fires that we selected. This is the broad organization of the CAFE report. It can be, it's thought of as 2 parts. The first part is more of a qualitative assessment. So we call it conceptual framework, background, and context. We thought this was really important and expanded upon the initial request. We felt, okay, we have all these agencies working together that in some cases had not worked together previously. We have all this differing expertise. Now's this really great opportunity to expand upon some of these topics that are extremely important when talking about wildland fire. And in some cases, write the comprehensive chapter that hasn't existed so far. Like one example is the air quality monitoring of wildland fire smoke. This is the first time that you've had multiple agencies on this topic writing a chapter together, and it's a really comprehensive assessment of what are the current wildland fire smoke monitoring capabilities. So it's just one example, but it's really getting into some of this important background information that we felt was necessary, even though it's not the main focus of the assessment, but it's important to put everything into context. And then that resulted in, or segued to part 2 of this assessment, which is the quantitative assessment, the quantitative aspect of some air quality modeling, estimating what the public health impacts are, and then summarizing all that information together. So one of the first things we did in developing this report was we felt it was really important to come up with a conceptual framework to really outline what are all these different components that we need to think about when we're going from land management activities all the way to the potential public health impacts of smoke. Granted, if we had information for all of these different topics, we could do our fuller quantitative characterization, but in many instances, some of the information that's presented on this slide is lacking quantitatively, but we still wanted to capture, these are all of the different effects of smoke, of fire itself that could be experienced during both wildfire and prescribed fire, recognizing the smoke impacts, the potential opportunities for ecological benefit and opportunities for mitigating or reducing smoke exposures. And so although this is a much broader conceptual framework than the quantitative analysis, we felt it was important to capture all of that. That leads me to the more narrower focus of this assessment itself on the quantitative side. And so this is capturing the thought process and components that went into our air quality modeling, health impact modeling, and recognizing that there are opportunities for smoke exposure reductions and mitigations due to prescribed fire as well as wildfire. So that ultimately led us to realizing the best way for us to approach this is through a couple case studies. I guess I should mention too that this project was proposed in January of 2020. It was initiated pretty much the instant all of us started working from home due to the pandemic. And so it was really a fast-moving project that the original goal was to have something done in a year. It took us a little bit longer than that, but the fact that we were able to accomplish this is somewhat a minor miracle considering everything that was going on in people's lives at the same time that we were developing this report. So the first case study we selected was the Timber Crater 6 fire. This was a small fire that lasted a few days in Crater Lake National Park. Now, in selecting the case studies, we did have some criteria around how we selected them. The first was that they needed to be jointly managed by both the Forest Service as well as the Department of the Interior. The second was that there was some information about previous land management practices. We wanted this information to help us both capture prescribed fire activity and develop some hypothetical scenarios as if there were more prescribed fire in land management or less prescribed fire in land management. And so the Timber Crater 6 fire was viewed as a success story, that there was a lot of information on previous prescribed fire activity in the location. And it was really viewed that it was because of this prescribed fire activity that it reduced the overall size of the Timber Crater 6 fire when it did happen. And so based off of the information we had on previous land management activity, we were able to develop hypothetical scenarios. And so this is a map of the Timber Crater 6 fire area in Oregon. This red area is the fire perimeter of the actual fire. And then the dotted lines and hatched lines that are presented here are representing the smaller and larger hypothetical scenarios. So the smaller scenario inside the fire perimeter of the Timber Crater 6 is depicting a scenario where there was more prescribed fire, more land management, reducing the overall fire perimeter of that fire, and ultimately reducing the overall daily emissions. Then we had two larger hypothetical fire scenarios. This blue dotted line is the larger one. Again, it's saying that there's less prescribed fire, less land management, more emissions. And then we have this worst case scenario. And this scenario is based off expert judgment, and that due to roads and some other defining features in the area, that they felt this was the biggest that fire could have been if there were no previous prescribed fire or land management activities. And so I'll note that in developing these hypothetical scenarios, we wrote this case study and the second case study I'll talk about, we relied solely on expert judgment. We understand that this is a limitation, but based off the time constraint that we were under in producing this report and analyses, that was the best we could do. But we did have people that were heavily involved in the management of these fires. And so they had expert knowledge on the progression of the fires in those areas, and felt that we felt like these were reasonable representations of hypothetical scenarios. So we used the Timber Crater 6 fire and the fact that it was a smaller fire as a means to fully develop our modeling approach. We felt that if we could do this on a smaller scale, it would allow for us to then scale up to a larger fire as a second case study. And so for that example, we selected the rough fire. Actually, I need to go back for 1 second because I forgot one thing. So as I noted, we did have prescribed fire data for the Timber Crater 6 fire. There was one issue though, we didn't know the exact dates of all of those prescribed fires. However, we did know the dates of a prescribed fire that happened in September of 2019. Granted, this is outside the window, or it's after the Timber Crater 6 fire. However, because we knew the exact dates of that fire, we modeled all the previous prescribed fire activity on those dates because we knew it fit the prescription requirements. And at least it gave us a little bit of confidence because we didn't know the dates of those previous fires to say, okay, the meteorological conditions are right for a prescribed fire. We understand this is a limitation in the analysis, but I think it also brings to fruition this other issue that, that we know that is being grappled with nationally, of having this refined database and repository of prescribed fire activity, both fire perimeters, as well as the dates of those fires. And so this shows how complicated this issue is overall of trying to get a sense of prescribed fire, air quality, and public health impacts, and trying to balance and assess trade-offs between prescribed fire and wildfire. So I apologize for going back, but that's an important point that I wanted to raise with respect to the Timber Crater 6 fire. So for the rough fire, again, same type of criteria in selecting this fire. Jointly managed on land that's represented by both the Park Service, or the Department of Interior, and the Forest Service. And again, this fire was selected because there was some previous land management information. However, there's one big caveat with the rough fire. There was no actual prescribed fire activity in this area. However, the Forest Service had done extensive modeling, planning for a prescribed fire, or a number of prescribed fires that were going to happen in this area, but they ended up not happening because of the government shutdown in 2013. So we were able to leverage all of the modeling that they had done and use some of that information to help us develop hypothetical scenarios for the rough fire. So similar to Timber Crater 6 fire, here's a map of the rough fire area. This red outline again is the actual fire perimeter of the rough fire. So even though there was the not prescribed fire activity in this location, there was a previous wildfire that due to wet fuel conditions was allowed to burn. And so it resulted in positive resource benefits. And so that's the sheep complex fire, which is this blue area here. And then the prescribed fire that we included in this analysis is the proposed Boulder Creek prescribed fire, which is this red area here. And so again, this is that fire that the Forest Service had modeled, and we were able to use that in the development of our hypothetical scenarios. So the two hypothetical scenarios we developed here, we have a smaller and larger fire. The larger, we allowed the rough fire to burn into the sheep complex area as if that fire had not occurred. And for the smaller, it was viewed, again, through expert judgment of folks that were involved in the rough fire, that the placement of this Boulder Creek prescribed fire on the outskirts of the sheep complex represented a choke point, and that it would have prevented the rough fire from burning downslope and then back through this other area. And so the smaller hypothetical scenario is this unhatched red area here. Again, we understand that this is a big uncertainty. The folks that are involved in this fire really believe that if this fire had happened, it could have had a substantial impact on reducing the overall size of the rough fire. This is the overall modeling framework that we used for the approach. We, again, leveraged both Forest Service products, which are in the blue shaded, and EPA products, which are the green shaded. The traditional approach that's been used in a lot of the air quality modeling for wildfires, as I'm sure many of you are aware, is through the Blue Sky pipeline. We did use that same approach, but we also incorporated a slight modification. We used VELMA, which is an EPA tool that allows for an estimation of above ground biomass. And by incorporating the output of VELMA with the FCCS output of fuel type and fuel loading, it allowed for us to have a little bit better characterization of fuel type and loading, which translates to a better characterization of smoke emissions and dispersion. So ultimately, all of that fed into air quality modeling, which then ended up being inputs to the estimation of health impacts using BEDMAP. And so after a discussion with Katie yesterday, I thought it would be good to have a couple slides just orienting you all on what BEDMAP is, because I think it'll make understanding the results that I'm going to present in a couple slides a little bit easier. So first, don't let the equations result in your eyes glossing over. I'm not going to get into too much detail with them, but give you a sense of how this tool functions and what's the information that goes into it to allow for the estimation of health impacts. So within epidemiology studies, we're relating usually the incidence of some health effect with, for air pollution, changes in PM concentration. And so that relationship is depicted here in a rather simple way. And then what we often are trying to assess is, well, what's the relationship between the incidence of a health effect and the change in some air pollutant concentration? And the slope, or this line here, is representing that relationship. And the slope of that line is called a beta coefficient, which translates into the calculation of a relative risk, which I'm sure many of you have seen in epidemiology studies or different documents conveying health risks. So that beta coefficient is an instrumental variable in this rather simplistic algebraic equation that allows for us to estimate what the health impacts are due to a change in air pollution. And so the next slide is then taking this equation and I think graphically and allowing, or not graphically, schematically allowing you to see how this functions. And so the way that BEDMAP works is we're defining some pollutant, which can often is PM or ozone, over some geographic location. Within that same location, we're identifying the population that is being exposed to that pollutant. we're identifying the baseline incidence of the health effect that we're examining, whether this is mortality or respiratory-related hospital admissions. What's the baseline incidence of people within that geographic area going to the hospital for a respiratory effect? Again, we're using the effect estimate or beta coefficient for an epidemiology study. And through using all of this information over the same geographic area, we're able to then estimate what is the health impact due to some change in air pollution. And so then now that turns me to how did we do this in these two case studies? And so the objective of using BenMap, which is a tool that the EPA has developed and has been using for over 15 years. It's used often in regulatory impact analyses for the National Ambient Air Quality Standards to estimate the costs of improvements in air quality. And so we're using it to quantify the number and economic value of health outcomes associated with both the actual and hypothetical wildfires, as well as prescribed fires. And so the way that we've accomplished this is that we are, as I noted on the previous slide, we need to identify a change in air pollution. And so for this, the way that we've identified that change is we recognize that there is some amount of ambient PM 2.5 or ozone, and we're looking for the increase that is being caused by wildfires. And so that increase caused by wildfires minus ambient air pollution gives us the change in air pollutant concentrations that allows us to then estimate what are the health impacts due to that incremental increase in air pollution as a result of prescribed fires or wildfires. The way that we, within the estimating the health impacts, we're using standard EPA health impact functions for ambient air pollution for both PM 2.5 and ozone. And I note this because, yes, there's a lot of health studies looking at wildfire-specific PM 2.5, but the issue is that across all the epidemiology studies, there's a variety of exposure metrics that are being used. And it's really complicated, the interpretation of the epidemiology results and the ability to then use those results in BenMap. And so we felt that for the main analysis, it made the most sense to rely on the health impact functions that EPA has used for ambient air pollution, but at the same time, conduct a sensitivity analysis that are using wildfire-specific health impact functions based off the wildfire epidemiology literature. So for both PM 2.5 and ozone, you can see the outcomes that we estimated health impacts for. And as I noted, we did a sensitivity analysis with wildfire-specific health impact functions. And then we also did a crude estimation of what the potential reductions in health impacts could have been if various interventions or mitigation strategies were done to reduce PM 2.5 exposures from wildfire smoke. So as I noted earlier, we did both this analysis for the Timber Crater 6 and rough fire. I'm only presenting the rough fire results for PM 2.5. And this is because the rough fire was a multi-month fire. It's a little bit easier to look at differences across the different scenarios because of the length of that fire compared to the Timber Crater 6, which was only a few day fire. So the couple take-home messages from this overall, the overall results from this case study. The first is that scenario 1, which is the small fire. So that's the one where we're assuming the Boulder Creek prescribed fire occurred, which resulted in a substantial reduction in the rough fire. You can see that there's an almost 40% reduction in the overall health impacts, regardless of the health outcome that we're looking at, whether it's respiratory ED visits, hospital admissions, or mortality, compared to the actual rough fire. So this is showing that the placement and timing of a prescribed fire can have a substantial impact on the progression and overall fire perimeter of a wildfire. But it's also important to recognize that even with prescribed fires or other wildfires that yield positive resource benefits, these fires are not without risk. You're still having air quality impacts as well as potential public health impacts. And so it really does become a trade-off of what are we willing to accept in terms of air quality impacts and public health impacts with the overall goal of trying to reduce the size of a future wildfire. This gives you a broad comparison of the overall economic values of the health impacts between the Timber Crater 6 fire and the Rough Fire. There is one difference in terms of the analysis that we conducted for the two fires, and that's in how we estimated mortality impacts. It's a little bit into the weeds, but because the Timber Crater 6 fire is only a few-day fire, we only estimated mortality impacts due to short-term exposures, whereas for the Rough Fire, because it was a multi-month fire and the concentrations were higher, it did impact annual PM concentrations, and so we only modeled long-term PM 2.5 exposure and mortality. But the take-home message from this slide is that even though the Timber Crater 6 fire was a much smaller fire and only lasted a few days, and there were interesting meteorological conditions during that fire, which resulted in relatively fewer population exposures to PM 2.5, there still were measurable impacts and associated economic values due to poor air quality from that fire. So that brings me to the limitations of the analyses. It's important to recognize that the results are specific to the locations of the case study fires. Both of these fires occurred on the west coast. We had specific, so both the fires occurred on the west coast. We know that the amount of prescribed fire on the west varies compared to the east coast. So there's a whole bunch of factors that result in our inability to readily transfer the results of this case study to other locations. It's important to recognize that the analyses are retrospective. That is, they occurred in locations where we knew wildfires occurred. And this really brings me to the next point of prescribed fires are, the goal of prescribed fires, I noted previously, is to reduce the overall size, intensity, and duration of a future wildfire. But we don't know if that wildfire is going to occur or not. And so we weren't able to incorporate some estimate of uncertainty into the analysis to account for the fact that there is a probability around whether a wildfire will or will not occur in the location in which a prescribed fire has previously occurred. Because of the fact that we didn't have information on the specific dates of all the prescribed fires, specifically for the Timber Crater 6 area, we were not able to consider the temporal and spatial components of prescribed fire activity, including return intervals. How often does the prescribed fire have to happen in in a specific location to make sure that we're keeping down the fuel in that location? As I noted earlier, the expert judgment was relied upon to determine fire spread and perimeters of the hypothetical scenarios. And lastly, we weren't able to factor in how the growth of the wildland urban interface might influence future exposures to wildland fire smoke, and even the potential change in the composition of wildfire smoke as it burns through more structures versus mostly biomass in some of these locations. In addition to these limitations, in the qualitative portion of the assessment, we did note some overall data gaps, specifically with air quality monitoring, recognizing that the current monitoring network was not designed with the intention of measuring wildland fire smoke. With respect to exposure assessment and epidemiology studies, as I mentioned previously, there's a variability in the indicators that are used and in the methods used to estimate wildland fire smoke exposure. And then even on the health effects side, a lot of our information to date has been on short-term or daily exposures. We don't really know what the health effects are of exposures over multiple fire seasons, or the long-term health effects, or the health effects due to long-term exposures to wildfire smoke over repeated exposures over many wildfire seasons. And so that leads me to the key insights of the case study analyses. I think we show pretty clearly that the smoke impacts of wildland fire are complex, both spatially and temporally, and can vary depending on the meteorological conditions that are occurring during prescribed fire and wildfire activities. We show that the predicted concentrations of PM 2.5 from prescribed fires are smaller in magnitude and shorter in duration than any of the hypothetical scenarios or the actual wildfires that we modeled. And that a lot of the overall estimated population exposures due to prescribed fires do occur over a smaller spatial extent, and specifically on days in which meteorological conditions are meeting certain requirements in order with that sole goal of trying to reduce population exposures. But as I showed on the previous slide with the economic values, even though prescribed fires are intentionally occurring on days to meet specific requirements, you're still experiencing smoke impacts and you're still experiencing potential public health impacts that need to be recognized. We show that with the Boulder Creek prescribed fire, it's an example of a situation in which if a well-designed prescribed fire is targeted for a specific location, it may be able to reduce air quality and health impacts of subsequent wildfires. As I noted already, that the case study results reflect that a wildfire occurred in both locations. Again, we're not able to account for the fact that wildfire may or may not occur. As I noted for the Timber Crater 6 fire and also for the prescribed fires, that smoke impacts are dependent upon population proximity to the fires, as well as meteorology. But we also know that that's within these very confined areas. We weren't able to account for it in our report, but we also recognize that smoke is not limited to the areas in which these fires occur, that you do see long-range transport of smoke into other states as well as across the country. Even though I didn't talk about it that much, we did also model ozone for the analyses that we conducted. For these two case studies, we saw that ozone had, or there was a relatively minimal ozone air quality impacts as well as public health impacts. And it really supports that the current public health focus being on reducing for wildland fires, being on reducing PM2.5 exposures is sufficient. But we also recognize that the pattern of ozone formation from fires has been shown to vary across the country. So again, this is an example of the results for ozone being specific, definitely to these case studies, and we're not sure how this translates to other parts of the country right now. Wildfires that are short in duration, small in size, and not near large population centers can still result in public health impacts, albeit much smaller. And I think the Timber Crater 6 fire is a perfect example of this. And although the analysis we did with respect to estimating the potential reductions in smoke exposure due to various interventions was very minimal, we did have an extensive discussion about the different activities that can be done to reduce and mitigate exposures within the assessment. It's abundantly clear that if we can communicate the benefits of reducing wildland fire smoke exposure, that we can reduce exposures to the population and subsequently reduce public health impacts. And so it's just that ends up that a lot of these communication efforts, specifically on the prescribed fire side, have not been more widely used. And so that's another area that we would like to explore more in the future, of trying to get a better sense of, what is the overall population, or what's the overall impact that could occur to population if we were able to communicate the benefits of employing a whole bunch of different apparatus, whether it's clean air filters or other actions to reduce wildland fire smoke exposure. And so with that, I just want to recognize the large team that worked on this, spanning multiple federal agencies. It was really remarkable that we were able to finish this report as quickly as we did, considering for many of us, this was the first time that we were working together, and considering everything else that was going on at home and in the world during this project. So with that, I am happy to take any questions.
Wonderful. I'm just going to leave your face on the screen, and we've got 3 questions in the Q&A box so far. The first one from Jeb Barzin. It appears, can you see these two, by the way?
Yeah, I can see them. Yep.
Okay. It appears that prescribed fire and wildfire impacts are primarily related to size of each type of fire, assumed that it seems to be that smoke attributes of the 2 types of fire are equivalent. Are there data or contextual thinking that helps evaluate this assumption?
I think that, I mean, that's a fair statement that, you know, the overall air quality impacts are heavily dictated by the size and the duration of the fire. I guess the other part that's in there that I'm not sure how well to convey is that it's also taking into consideration the fuel on the ground. And so, you know, there was relatively detailed information on the fuel loadings in those areas that did help with the air quality modeling. But I think that the only other piece of information that I could think that would add to that would be the fuel loading information in each of those locations, because even though a fire the size of the fire could be the same in two locations, if the fuel loadings are different, then the overall emissions will be different. I think a perfect example actually is that Sheep Complex fire, which was a fire that was allowed to burn because of wet fuel conditions. And so the overall air quality impacts of that fire, I don't know how they would have been different if it was dry fuel conditions, but they were smaller, but they were relatively smaller because of the fuel conditions. So obviously it's also going to change depending on whether it's dry or wet fuel conditions and the overall fuels in those two locations.
Awesome, thank you. Joe Stutler, you can see his. In the beginning, you mentioned USDA and DOI policy issues. Please give examples of needed policy changes to expand prescribed fire in public lands. What are the barriers in existing policies from your perspective?
That's a little bit harder one, because I don't know if I can actually speak to policy issues in the other agencies that I'm not a part of.
Sure.
But I think a lot of it is also public perception. You know, I'll give a perfect example here. I live in North Carolina. There's a state park that's down the street, and I go running in it, and I've seen every time I've gone the last couple of weeks, there's a sign in there talking about prescribed fire, but I've never received a notification that there's prescribed fires happening. I mean, I haven't smelled smoke, but I think, you know, letting communities know when those fires are happening. There's other policy issues I think that USDA and DOI deal with that I can't speak to, because I'm not in those agencies. So how does EPA plan to use this study? So it's not as a means to change policy. You know, obviously we can't, you know, wildfire is hard because it's a natural event. And I think, you know, we're interested in trying to grapple with, you know, what are the health effects of wildfire smoke? What are, more importantly, what is the information that we can provide people to protect themselves? What are actions that people can take to reduce exposures? A lot of the wildfire work that EPA has ongoing, yes, there's health effects work that's being done, but a lot of the on the grounds work is developing smoke-ready communities, trying to convey or trying to examine you know, how well certain apparatus do at reducing smoke exposures. You know, we had a sensor challenge that came, you know, that was announced a couple weeks ago of low-cost sensors that people could use to, you know, to be able to provide them information on how much smoke they're being exposed to. There's some other work that's been done looking at clean air filters, and so EPA is using it kind of as a jumping off point. We want to try and continue to foster these interagency collaborations, because this is not a one agency problem, it's a national problem, and trying to find ways to further inform the different issues that we're grappling with, both on the prescribed fire and wildfire side.
If you scroll back up, Jason, you'll see a follow-up question by Amber Ortega.
Okay.
Prescribed fire is often done as a mosaic on the landscape versus tens of hundreds of thousands of acres as frequently seen in wildfires. Over the course of a season, we've seen factors of 10 less acres complete from prescribed fire compared to wildfire acres burned.
Yeah, and I think that gets at the issue that I was raising earlier, that we weren't able to account for the spatial and temporal component of prescribed fire. And I think well, this is me speaking, in my viewpoint, that's one of the biggest areas that we're trying to understand, how, and it's getting a sense of, I mean, one thing that we have in mind that we need to try and explore is, how often do the areas, granted we have to define some spatial area, but how often do the areas that experience prescribed fires also experience a wildfire? No one knows the answer to that question. And so I think it's trying to get a sense of how much prescribed fire has been done, where's a data repository that allows for us to then overlay wildfire on top of that and start to answer that question of, looking at prescribed fire, how does that impact future wildfires? The impact it has on reducing the size of those future wildfires. So there's so many unanswered questions that as we were working on this project, we had more and more questions that came to light. And we really view this as, again, this jumping off point of, how do we continue to explore this really complicated issue?
I like that. There's a quick, don't answer Joe's just yet, because I let him come on live. And I want to have some more conversation around his question, but there's a quick question in the chat box. Does the data show cause and effect or correlation of smoke exposure and health effects? From Ray Meow.
Okay, so where's that one?
It's in the chat box.
Oh, in the chat box, okay. Sorry, there's a
Q&A
box.
The chat box
so the epidemiology studies they're not correlation studies, because they're looking at, they're controlling for a whole bunch of confounders. It's not just, I'm gonna look at air pollution and I'm gonna look at this health effect and look at that correlation. They're more complicated statistical models that are trying to parse out what is the risk of a health effect due to air pollution exposures. So our study was not conducting epidemiology studies, but it was using data from previous epidemiology studies to then estimate the health impacts.
Awesome. I'll highlight Joe's question here, and I've turned him on. Joe is our co-chair for the Western region of the Wildland Fire Leadership Council, and he likes to pose some great questions. And so I'm hoping that if you raise your hand, I can turn your mic on and we can have a little bit more of a conversation here. Given the need for EPA and federal agencies to increase prescribed fire use, what would a communication strategy look like to move people towards learning to live with wildland fire? So Joe, you go ahead. I think you're on already. Start that conversation, and I'll try and catch other people whose hands go up, and I'll let you chime in as well.
Okay, Katie. Well, thanks, Jason. Thanks for the presentation. And, anecdotally, we've known that prescribed fire could, not only from a smoke perspective, but fire effects could make a huge difference. And when we look at, the various terrains and geographic areas across the country, much different in the West and both seasonally and than it is certainly the Southeast. But so the example you gave of you saw the signs but no notification. So if there was a communication strategy for the federal and state agencies and EPA and others regulating air quality kinds of issues, what would that communication strategy look like? That would are we just talking about somebody send you a text, there's a prescribed fire? What would that look like to enable the use of your data and to move people along and move the needle for more acceptance of prescribed fire?
That's a really good question. And one thing I'll just note is that I think in your question here it says, given the need for EPA to increase prescribed fire use, I don't know if I would say that, because we're not in the land management business. But definitely for the other federal agencies, that's definitely true in their thinking. It's interesting. I just saw, and I'm not sure if you all are aware, but the state of California just released this prescribed fire plan a couple months ago, I think. And then they also recently released this listening session, results they had with folks about prescribed fire. And a lot of it all came back to wanting to know when those are happening, wanting to know what actions they can take to prepare themselves. I think what you said is part of it, of letting people know when they're happening, but then also educating people about what they can do to protect themselves. A lot of the work that EPA is involved with now is trying to figure out and working with different communities of what are the things they need to have in place to provide the information to the public to make sure they can take the actions to protect themselves. Because in many cases, people might not have the resources to go buy a clean air filter, or maybe clean air filters aren't readily available where they live. So I think it becomes a much bigger strategy than just letting people know through text messages or a news alert that a fire is happening, but trying to make sure that people have the resources and other things necessary to protect themselves.
Well, I appreciate that. And I would just offer, Jason, and certainly the other people on the webinar, is that what happens when you think about the cohesive strategy, one of the terms that's used, all hands, all lands. And we look at barriers at times with prescribed burning. Certainly air quality becomes one of those. And so it's sometimes there's a fallback of well, it's the air people that are keeping us from doing this. And, I just think that consistent messaging from an all hands, all lands perspective in the context of learning to live with wildland fire, that, I know that EPA and yourself have been involved with this for several years, and I certainly view you as a stakeholder and partner with this. And so I think that communication strategy should resonate, whether you have a single acre to manage or if you're managing an entire program such as EPA. So just offer that as a suggestion.
Thanks, Joe.
Thanks, Joe. I see Jeb did have his hand up, but it looks like he took it down. Is there anything you'd like to add to the conversation, Jeb?
Yeah, I'm sorry. I'm kind of a Luddite with technology. So I'm very curious about quality of smoke, but I don't know if the magnitude of that is important given the kinds of comparisons that you're making. So if you had fuel loads the same and you controlled for them, essentially, a prescribed burn by definition is going to burn less of that fuel load than will typically a wildfire. In that 10,000 hour fuels are less likely to burn in a prescribed burn than they would be, say, in a wildfire. But what you do then is you have to do several prescribed burns to reduce fuel completely. So you probably have the same amount of smoke in accumulation burn, but what a prescribed burn is doing is spreading that out over time. And that effectively, I would think, impacts smoke quality in any particular event that you're looking at, which then would have a bearing on health impacts. So my question really, so I'm just trying to think that through on a logical basis. Hopefully there's logic to it. But what I'm curious about from you is, with the analysis that you did, would that effect be so small that it's not worth incorporating into the overall things that you were really comparing, or is a sensitivity analysis warranted where that actually might have a bearing on your overall assessment of smoke quality?
No, you're exactly right. And that's one of the things that we grappled with. And that's where, let me share my screen, because I have some additional slides that I didn't share for the Timber Crater 6 fire, because that's the only fire that we had multiple prescribed fires. But again, we didn't know the dates. And so we're modeling all of them as if they happened on the same days of the same month, even though it was like 5 prescribed fires. And I think that's the big question of moving forward is, and you perfectly stated it, that it's not one prescribed fire, it's a number of prescribed fires over time, and recognizing that maybe I didn't say it as eloquently as I should have earlier, but my personal viewpoint is this becomes a risk management decision. How much smoke are you willing to expose people to, with the hope, or I guess with the probability, that a fire may or may not happen in that location. granted, the spatial location is probably fairly large because you're doing prescribed fires all over the place with this goal of reducing fuel load, increasing forest resiliency. And so that's where I think part of the future work is trying to get a sense of what is the impact of these repeated exposures that are happening. And sometimes they might happen once a year. If there's only one prescribed fire in a location, again, there's all of these other variables that we weren't able to account for. And as I've read more stuff recently about, specifically in California, some of the issues they're running into are, they've had so many people fighting fires that when it's the seasons to have prescribed fires, they might not have the folks available to conduct those prescribed fires. And so it really does become this question of trying to get a sense of looking at these smaller exposures from prescribed fire, getting a sense of, is the total amount of smoke that's happening during those events equal? I mean, I doubt it is, but equal to what you're seeing if a wildfire happened, and kind of like turning it into this real trade-off. Like ultimately, that's what we would have liked to have done, but we were under a fairly ambitious timeline of getting this project done. And so we did the best we could with what we had. And it also goes to that point of me saying that we couldn't capture the spatial temporal component of prescribed fire. My hope is that we can do some of these analyses where we're recognizing that prescribed fires are happening in different locations at different times. And how do we account for the public health impacts of that? And it's that in my mind is one of the bigger questions of this project. And how do we move the needle on that moving forward?
Did you see Bob? I'm going to butcher your last name, Bob Isel. I hope that's right. That kind of gets to what we talked about before. Is there anything additional there? And I turned your mic on, Bob, if you wanted to add to that conversation.
Wildfires burn under high.
I think we talked about that a little bit.
Yeah, no, I think that what you state is exactly correct, and that's what that's what we tried to model with the air quality modeling that we did, and the prescribed fire concentrations. I think I can, let me see a second. I don't know what's being shared right now. Is it my full screen?
It's not your full screen. We've got the ones on the side too.
Okay, hold on.
There you go.
I think I have some other, to kind of give you a sense of, okay, so these are figures that are all in the report, but I didn't display them for out of time constraints because they're a little challenging to walk through. But this is an example of the Timber Crater 6 fire, and so as I noted, it's a shorter duration fire, but you can see the overall PM concentrations from that fire and the different hypothetical scenarios. And on the right-hand side are the prescribed fires. And so you can see that these are happening over, again, a short duration too, which is not all that different than the number of days that happened for the Timber Crater 6 fire itself, but the overall concentrations are less compared to the fire. And so it's getting at that exact point that, we see smaller concentrations during prescribed fires, shorter duration. And then I think I have one for the rough fire too in here if I can find it. And this is I don't have the prescribed fire. Oh yes, I do. Hold on a second. And so this is the prescribed fire, the Boulder Creek on the left for the rough fire, and the bottom right is the Sheep Complex fire. And so this is another one of those examples of where you were noting the fuel conditions and how they can highly contribute to what the overall concentrations are of smoke. This is wet fuel conditions, and it burned for a couple months, and the overall concentrations are relatively low for PM, even compared to what you see for the proposed Boulder Creek prescribed fire. So, yes, the fuel conditions as well as the types of fuel will impact the concentrations.
Amber Ortega had her hand up at one point. I just want to circle back to you, Amber, if you had a different question or wanted to add to the conversation.
It was more along the lines of talking about the 100% consumption and prescribed fires that I think maybe Jeb brought up. Mm-hmm. And just wanted to bring up that, there is a difference in how wildfires and prescribed fires burn based on the intention. Oftentimes for prescribed fires, we don't want those heavy fuels to burn. We're burning out the underbrush as routine, ecological process. So oftentimes a wildfire, if it gets really hot, if you've ever driven through the black of a wildfire, it's completely burned down to bare mineral soil, which isn't actually biologically helpful at all because there's nothing left to continue that ecological development. Oftentimes in the prescribed fires, we don't want those heavies to burn at all. And so the way smoke models capture that and the way that they're thought about is kind of fundamentally different in terms of just looking at a footprint on the ground and thinking 1 pixel burned equals everything's black. So I just wanted to bring up that caveat.
Yeah, but and that those are things that were considered in the modeling of the prescribed fires. They had detailed fuel loading information and perimeters for the fires, and so that was all factored into differences in the modeling of the prescribed fires compared to the hypothetical and the actual wildfires.
Well, and I comment that not so much on your study, but more on the interpretation of it. And that oftentimes when we're not necessarily doing the burning ourselves, but looking at it remotely, like from satellite images or from footprints, the 1 pixel, so to speak, is very diverse. And there's, surface fuels, there's ladder fuels, there's all kinds of different levels of fuels, 100-hour, up to higher and higher. So just because an area is considered black and burned doesn't mean like everything in that pixel burned, or even that, the available satellite-based fuel type is every fuel type contained in that area. So that was my comment just in interpreting these results.
Thanks, Amber. We got a hand raised by, I hope I say this correctly, Lyda Hayes. And you had a question. Go ahead and just ask your question live.
Can you hear me?
I can hear you.
Oh, yes. The people in my community, I'll just kind of read what I said. Balk at prescribed fire. They cite health dangers of smoke. They said, "Oh no, we're old people. We can't handle it." But they're the first that'll pull the fire permits and have this kind of like college-like bonfire in their backyard to burn the few leaves that they have, and it sets a pall over our valley here in Western Nevada. And the smoke season's now 3 to 4 months long. So how can we connect people's hearts and minds to prescribed fire, to relate prescribed fire to reduce smoke season? People don't see that the big wildfires are the ones that are causing this smoke season. And if we could get prescribed burns in various areas, how helpful that would be. How do we make that connection? And I know that's what we're all trying to do. But is there, some kind of organizational psychology, behavioral economics that we can tap into? I'm really concerned about that.
That's a good question. I'm not sure I have a good response to it. A lot of the work EPA has been doing to date has really been focusing on wildfires and communicating to the public actions they can take, and recognizing things to do when there's poor air quality. Like I'm not sure how many of you are aware, there's a smoke sense app that colleagues of mine have developed to communicate to folks different health symptoms they might experience during wildfires. As I noted earlier, there's a Smoke Ready Communities project that's ongoing, and other types of communication through there. We haven't, on the EPA side, have not embarked yet on prescribed fire communication information to communities. I know WIFLIC has been heavily involved in that, as well as the Forest Service and DOI. And we have a little bit. There was a joint communications document that we developed with WIFLIC about a year ago on prescribed fire. And that, I think, is on the WIFLIC website. I don't know, Katie, if you if you're aware.
I don't know if it is on the website, but I'll make it available to everybody. I'll see if there's a link to it or if I can just make it available. That said, one of our big priorities nationally at the WIFIC level and then at the regional level is smoke readiness in communities. We believe that that is a necessary part of fire adaptation and becoming fire adapted communities. And so we've been working with some folks in California, and I like where we're going with, what does the communications strategy look like? And we're trying to gather up some of that information and share it, not just regionally, but nationally with all of you, all of our stakeholders, because it's going to look a little different in every community. But if we can share that information and you can cherry pick what would work better in your community, we think that will be somewhat helpful. So it's great to hear some of your suggestions. We've been looking at that too, and how we might be not only a convener around that space, but also provider of some of that information that can be shared state to state or nationally. So I'm glad we hear that. I want to make sure I didn't miss Rick Graw's question. Is EPA or WIFLIC considering or planning additional studies? What did you learn from this one? I'll tack onto that, Jason. Anything else that where do you all want to go next, or where would you like to see somebody else go next?
Yeah, that's a great question. I mean, there's a lot of areas that we identified along the way. We're trying to, after the full-on press to get this project done in less than a year and a half, I think we all took a little bit of a break to decompress and think through what we did and where do we go next. And so that's kind of where we are right now of thinking through how do we build upon these interagency collaborations that we were able to develop in producing this report. I think some of the areas are ones that we've touched on already, such as getting a better accounting of the spatial and temporal components of prescribed fire smoke, as well as prescribed fires themselves and how they interact with wildfires. Trying to understand how the probability that wildfires occur in locations where prescribed fires have occurred. There's not much information on that. Trying to get a sense of how this type of analysis varies regionally. I mean, in the Southeast, it's predominantly prescribed fire, whereas in the West, that's not necessarily the case. And so there's a lot of different angles that we've been thinking about. We haven't really decided on what next steps are, but we're definitely thinking of how do we build upon this. We didn't view it as a one-off, but as a stepping stone to further examine this really important issue.
Thanks, Jason. We are at the top of the hour, and just to be respectful of everybody's time, I just see one quick new message. Oh, people are diving off. I want to say thank you to you, Jason, for giving us the time today and helping us think a little bit more about where to go next and how we can all implement these in our communities.
Thanks for the invitation, Katie, and I'm more than happy to follow up with folks if they want to, email me other questions. More than happy to do that.
Great. All right, and just I would be